Hello everybody, I'm Mike Clarke from Evidence Aid and Queen's University Belfast, and I'm very pleased to be able to present to you today a presentation on determining the research question for studies in health emergency and disaster risk management, which is based on Chapter 3.5 in the WHO guidance on research methods for Health EDRM. I'm very pleased to have been able to co-author this chapter with Yonggang Zhang from the West China Hospital at Sichuan University in Chengdu, China. So let's begin. What are we going to try and cover today? I'm going to try and help you to understand the key factors to consider when determining the research question for an area of important uncertainty in health EDRM. These include deciding on the general issue that needs to be studied, defining a precise research question for the study, and then confirming that the study is a priority, that it will make an important contribution to the existing evidence base and will not waste funding or other resources. When we're thinking about research, first step is to decide on the broad topic. Research studies can be observational, they can be experimental, or they might use computer-based simulation. To give you an example, if we go back to the great East Japan earthquake of 2011, observational research might be done to identify the number and types of injuries caused, to determine subsequent mental health conditions, or to determine the consequences of mass evacuation. In observational studies, we don't interfere, we don't intervene, we simply watch and count. Experimental research, we introduce something new and we evaluate it. So it might be done to evaluate different ways of treating injuries or mental health problems. It might be used to evaluate different methods for risk communication to encourage people to evacuate safely. And we might use computer-based simulation for rare events such as Chernobyl or Fukushima in order to predict the likely impact of a policy such as shelter in place. So that we do next, we define the research question. It needs to be formulated correctly because it will underpin the choice of the type of study. It will make what is being investigated clear and obvious to ourselves, to our colleagues who are part of the research, and to the eventual users of that research. It will ensure that we use the correct measurement tools. It helps to avoid potential bias, such as any that might arise if the study's accumulating findings lead to unplanned changes. And it will ensure that the completed study will provide a clear answer. So again, let's just think, what would be a good research question if we were going to study something around inpatients and deaths in West China Hospital of Sichuan University, where Yonggang works, following the Wenchuan earthquake of 2008. So we could have research questions such as, what were the gender, age, source, distribution of admission time, and types of injury of the patients admitted to the hospital? What were the causes of death among patients admitted to the hospital? And these research questions were posed and were answered in studies done at the time. And you can find references to those studies if you look in the chapter online. So now let's move to defining the research question and its impact on the study design. Example I'm going to use is using fish oil to treat people with post-traumatic stress disorder or PTSD following a disaster. So that might be the broad topic that we're interested in, but that's not a research question. That won't help us choose the study design. That just tells us the topic that we are interested in. So let's start working through some questions. First question might be, does taking fish oil have more or less benefit than not taking it? So that study is going to require a comparison of fish oil versus control. It will not show, however, if fish oil is better, worse, or the same as taking a different therapy or using a completely different type of intervention. It simply will say, is fish oil better, worse, or the same as what we might conceptualize as nothing, as just doing usual practice. So if we want to move on and say, well, is it different to an alternative? The question might be, does taking fish oil have more or less benefit than an alternative intervention, such as counseling? The study now becomes one of fish oil versus counseling. It will not, however, show if fish oil might provide further benefit when given in addition to counseling. So this is a straight head-to-head comparison of fish oil and counseling. It doesn't tell us anything about what benefits we might see if we combined them. So what would that question look like? Does fish oil bring any additional benefit when given with other interventions for post-traumatic stress disorder, such as counseling? The question now becomes counseling plus fish oil versus counseling alone. So it's now saying, does fish oil add anything? But it won't necessarily answer the question of when should we use the fish oil? Should it be taken immediately or should it be taken at some point in the future? So what's that question going to look like? Does fish oil have similar effects if given immediately after the disaster or at some point in the future? The questions leads to a study, which is now one of immediate fish oil versus delayed fish oil. And what's missing? Well, I can't spend the entire presentation going through all of the possible permutations, but you could see that there are many more that there could be. There could be early fish oil versus delayed counseling, delayed fish oil versus immediate counseling, immediate fish oil with delayed counseling versus etc., etc. You should now have a sense that you need a very clear research question before you start thinking about the study to use, the study design to use. These are experimental examples. Avoiding research waste. So the next step, clear research question, appropriate study design, make sure you're not wasting things, especially important in the context of Health EDRM. Research that is not necessarily waste resources and can cause harm. So to avoid research waste, a new study needs to answer a question that's not already been answered by previous research, and it needs to be a priority for Health EDRM. Now, there are other chapters in this book, and there are other presentations that you can see at the online resources for the book that touch on some of these issues. So I'm just going to introduce some of the concepts and point you to those chapters. So before conducting a new study, we want to check, is the answer already out there? We should review the existing research to ensure that the research question has not been answered already. You might do this in a scoping review, and chapter 3.6 in the book provides guidance on how to do that, or in a systematic review, and that's covered in chapter 2.6, or by finding a recent review done by others. And you can have a look at chapter 3.7 for information about that body of evidence that is out there in reviews done by other people, and 6.2 will give you guidance on how to do searching. Reviewing existing research can also help when designing the new study. You might identify practical lessons from the past that you can use in the present and the future for your new study. So here's a case study. This is a Cochrane review that was done in 2011-2012 to inform England's national heatwave plan in the run-up to the 2012 Olympics in London. So the national heatwave plan needed to be updated just in case during those weeks of the main Olympics, during the weeks of the Paralympics, there had been a heat wave in London or more widely across the United Kingdom. And it highlighted important uncertainties about whether or not electric fans actually improve or worsen serious morbidity and mortality during heat waves. And it provided the basis for the design of a randomized trial. So in the Cochrane review, we provide a design that people might wish to consider if they were going to implement a study to assess the effects of electric fans on serious morbidity and mortality during a heat wave. Here was the design. A randomized trial, possibly a cluster trial across specific settings such as care homes or regions, comparing electric fans, the provision of electric fans versus routine care. During a heat wave, adults who would be likely to be representative of a general population, but perhaps with a particular focus on those aged over 65 who are living in residential or care homes. And the outcome measures would be the use of healthcare services, heat-related illnesses, deaths, and self-reported comfort. So we're capturing the serious morbidity and the mortality, but also whether or not the fans made people feel more comfortable. And that would allow us to answer multiple questions and balance the potential benefits and potential harms of using electric fans. So we then move on to, is the research a priority? It's challenging. Chapter 2.7 provides some guidance on how to use various frameworks for identifying research priorities in healthcare research. Health EDRM example is the Radiological Nuclear Threat Countermeasures Working Group identified and prioritized 18 areas for radiological or nuclear threat countermeasures for research into that. But we also need to ensure that rapid research might need an appraisal, and that has been developed for infectious disease outbreaks. And again, if you'd like more information on those two examples, they're available in the book. In 2011, UNICEF reported the efficiency of knowledge generation and dissemination at both the global and country levels is diminished by a lack of coordinated systematic planning and rigorous evaluations. Insufficient coordination in establishing research priorities and planning evaluation detracts from development of a focused research agenda in early childhood development. People recognize the need for good priority setting, but it is challenging. Evidence Aid in the early 2010s did its own exercise to set priorities for systematic reviews relevant to humanitarian action. Worked with partners to identify reviews that could evaluate health EDRM interventions, began with an initial needs assessment which identified hundreds of relevant research questions, which were then grouped under 43 themes. An online survey was used to prioritize 10 of those themes, and questions attached to those themes were then discussed in a 2-day face-to-face meeting in May 2013, which led to a list of 30 highest priority questions. So it was a collaborative effort, but it identified research priorities for systematic reviews. If we were planning a new impact evaluation, there are many features of that we need to think very carefully about. And here's a framework, and this was a framework developed with 3IE. First step, the feasibility of undertaking the impact evaluation. You need to consider the difficulties that you may have with the methods. How easy or difficult will it be to find the comparison groups? Will there be operational difficulties in defining and delivering the policies, the interventions, the actions or strategies that you're trying to evaluate? And might there be institutional level difficulties with perhaps a lack of willingness on the part of those who wish to implement the policy, the intervention, the action or the strategy? Perhaps there's a degree of hesitancy among them about evaluating them. Then, what to evaluate? You need to consider whether or not the impact evaluation should be of a topic that will be particularly easy or difficult to evaluate. Place yourself on that spectrum. Do you want something easy to evaluate? Or do you want to really test things and it might be difficult to evaluate? For example, it might be relatively easy to do a randomized trial of a particular medical procedure for treating cholera. But a complex intervention to improve the protection of women and children in a displaced person camp might require a range of quite difficult to measure outcomes, such as gender-based violence, dignity, livelihoods, whereas the cholera study may simply rely on measurements of cholera. Use of existing evidence when prioritizing the individual impact evaluation, which I've already touched on. You need to consider whether to focus on areas with little or no existing research, or areas with a relatively large amount of research that is not sufficiently reliable or robust. So very few people or no one has studied it yet, but it's important, or many people have studied it, but not well enough to resolve the uncertainty. Creating review standards. You need to review the existing evidence to confirm that there is sufficient uncertainty to justify the new study. And when that study is complete, you need to place its findings in the context of the other relevant studies so that the user of your report has up-to-date evidence, an up-to-date summary of the evidence base. Choosing the intervention to evaluate and thinking about innovation. Just consider whether or not you want to focus on innovative interventions or those that are already widely in use. Do you want to test something very new, very novel? Or do you want to test something that people are using, but maybe has not been formally evaluated? Maybe we're not sure about the benefits and potential harms of that intervention. Maybe we need to quantify those things. Maybe we need to see if it can be used in different settings. Strong urging here, follow the phrase, no innovation without evaluation. If you're going to do something new, you should be prepared to evaluate it. If you want other people to use it in the future, they should demand evidence on how effective it is. Still on choosing the intervention to evaluate, think about, in the humanitarian context, the relationship to the development sector. And you may want to consider whether to focus on interventions where there's considerable overlap with the development sector, where after the immediate impact of the disaster is moving into later stages of the disaster cycle. Very relevant to Health EDRM, very relevant to resilience. So how much overlap would you like to see there? This is a framework to allow you to pose and answer these questions before you embark on research. This is a framework that funders of research, gatekeepers of research, might wish to use before they allow research to go ahead. And this is a framework that you might use when you're looking at somebody's research to try and determine its relevancy to you. Still on choosing the interventions to evaluate. You want uncertainty, controversy, debate. So do you want to focus on areas where there's a lot of uncertainty, where there's a lot of controversy, where there's a lot of debate about their relative effects? Or do you want things about which people are more confident? You have choices, make them wisely. Then we need to think about the populations we're going to study. Consider whether to focus on particular subgroups of people, such as the vulnerable or disadvantaged, often the people that are not given the opportunity to take part in research. And if they're not given the opportunity to take part in research, we've got to start asking ourselves, how relevant is the research findings to them? Or maybe we'll study the population as a whole. Again, choices, make them wisely. Settings for the impact evaluations. Do you want to focus on sudden onset disasters? Possibly with the need to have some impact evaluations on the shelf, ready to go in the event of a future disaster, or for ongoing protracted emergencies. Choose. And then phases for the impact evaluation, whether or not you want to focus on resilience, risk reduction, the immediate short-term response, or the prolonged response of engagement. Where are you going to position yourself in the disaster cycle? Choosing the outcomes to measure. Consider whether or not a core outcome set should be used or a new one developed. Core outcome sets exist to guide researchers towards the outcomes that a consensus process has said are important. And I'll show you an example. In the absence of a core outcome set, you need to identify and measure those outcomes that will be most helpful to future decision makers. And then we also should be taking the opportunity to evaluate our own evaluations. So you should consider whether research into the methods that will be used in the study should be embedded in the study. For example, in a SWOT, which is a study within a trial. Impact evaluation of the impact evaluations. Consider whether the study should include that sort of evaluation, either by the research team working on the study or by someone independent, and also whether it should include an actual evaluation of what difference did it make. So the SWOT is there to say, how good are the methods that we used? This evaluation could be there to say, did we make a difference on future policy, future practice, outcomes? And then think about dissemination and implementation. Research is not about building CVs, getting articles into journals. It's about impacting on policy and practice. And to do that, you may need to do more than simply publish the findings of your research. So you should consider an implementation or knowledge translation plan, which should include how best to reach the key decision makers and how the findings might be made available to those who took part in the study. They have a right to know what the findings were. And we also know from other evidence and other studies that people that take part in studies are more likely to lead the uptake of the findings of those studies. So keep them informed. Choosing the right outcomes to measure. The outcomes measured in the study need to answer the research question and be useful to decision makers. Inconsistent measurement and reporting of outcomes exists, and it's research waste. And we don't want research waste. Core outcome sets reduce this waste by providing an agreed standardized set of outcomes for research, and the COMET initiative provides support for the development and uptake of core outcome sets. Again, just Google COMET initiative and you'll find the website. You'll find information on existing core outcome sets and guidance on how to prepare them. A Health EDRM example is a template with 15 data elements to collect, report outcomes during acute disaster medical response. It's a case study in the chapter. The Academy for Emergency Management and Disaster Medicine brought together 16 experts from research, education, ethics, and operational aspects of disaster medical management from 8 countries. They met at Utstein Abbey on the island of Mosterøy off Norway in November 2010 and generated a template which contains 15 data elements with indicators that can be used for research and quality improvement. Then be research ready. Scoping reviews can help plan a piece of research, and they're discussed in chapter 3.6. You might do a pilot or feasibility study that could help develop the methods for the definitive study. And sudden onset disasters, as I've already said, might need to have plans for a new study on the shelf, pre-prepared and ready to be activated. And in the UK, the National Institute of Health Research has a portfolio of such studies in place for an influenza pandemic, which includes a randomized trial of steroids for the critically ill. So to finish, the key messages. A clear research question will inform the study. It's vital for a research study. It is going to identify an important evidence gap and address that evidence gap in Health EDRM. The outcomes to be measured and reported should be chosen carefully. They should allow the study to answer the research question and provide the evidence that will influence decision makers in the future. A review of existing evidence before you do the new study will help ensure that it really is a priority and that the research question has not already been answered by existing research. And finally, if the study needs to be implemented rapidly, perhaps in a sudden onset disaster, you might want to do a pilot or feasibility study, and you might want to have the design on the shelf and ready to activate. Thanks very much for listening. Thanks very much for watching. I hope that this has provided a good introduction to you on the importance of choosing the topic carefully for research, defining a clear research question, fitting the study design to that question, making sure that you minimize research waste, making sure that you measure things that matter, making sure that you deliver a study that will make things better for the future because of the evidence that you produce. My contact details are on the screen. I'd welcome questions from anybody who would like to pose them, any additional information that you would like to have, then please don't hesitate to contact me. Thanks very much.
This is the second webinar in the series, and the first webinar, which covered chapters 1.1 and 1.2, those videos are available. So I put into the chat the link to the chapter itself. The link to the whole book is on the holding screen that Claire began the webinar with, and we will put up to finish as well.
And Mike, we've got a question from Patricia Anderson asking, has any work been done on collections development as part of preparations to support disaster response?
Patricia, could you just clarify what you mean by collections development?
Patricia, I've just unmuted you, so you should be able to clarify that question.
Thank you very much. What I'm thinking of is in disasters, we can anticipate what the most likely disasters are for our region or area, and we can anticipate what types of information needs are most likely to come up under those circumstances. Eric Noji has done some work on identifying information needs matched to specific disaster types. And so I'm thinking, but it's all buried in this giant book with little tiny words here and there. And I'm thinking, is there a model that extracts that type of information so that we can apply it in information professions and to do preparatory collections development work to ensure that we have on hand ready to go the types of information like you're doing with the search strategies. I'm also wondering, for the framework that you developed, if there's some sort of mnemonic or tool for remembering the stages, because that would be helpful.
Great, thanks, Patricia. So in terms of collections, one of the things that Evidence Aid does is when we identify systematic reviews that are relevant to the humanitarian or the disaster sector, so that's where people have brought together collections of studies relevant to a particular question, then we're trying to make as quickly as we can summaries of those reviews and make them available on evidenceaid.org. I think that there is great scope for going further in the way that you've suggested, and I'm not sure if this may be a possibility for the WHO Knowledge Hub that all of these videos, the book, etc., are feeding into, but I think that's certainly something that we could be discussing in the context of the WHO Knowledge Hub.
So Angie has asked, when running a small team, is it ever appropriate for staff researchers to continue refining research questions or defining new ones to help guide and scope their work streams?
Thanks, Angie. Good question. And I would say definitely yes. I think that people should be thinking about research that would improve how they do things. There is a challenge, though, with that in the sense that you need the appropriate skills, you need the appropriate skill mix and expertise in the team. So I would encourage staff researchers, people delivering any form of service, to think about the research questions that need evaluating, to think about the uncertainties that could be resolved by research, and then to be working with the necessary expertise to build evaluations, so they're not wasting opportunities, so that they're not doing research that won't actually be helpful to them, that it's designed as well as possible. But definitely, people should be identifying uncertainties in what they do, and they should be trying to find ways to resolve those uncertainties for themselves, and also then making the findings available so that similar people with similar uncertainties can benefit from what's already been done. Patricia, I did forget the second part of your question, which was the mnemonic. Unfortunately, no. I do like mnemonics, PICO, and so on, that people will be familiar with for designing research questions. We don't have one for the framework for thinking about things. I think it would be quite an uncomfortably long mnemonic in order to do that. But thanks for reminding me of the question. If there's no more, I'm quite happy to thank everybody for listening to me. Thanks everybody for watching the video. The slideshow as well, just to say that will be available as well in the WHO Knowledge Hub. So if people want to borrow those slides for any purpose whatsoever, you're welcome to do so. If the ideas have helped you to think about how you might do research or how you might teach other people about research, please feel free to use the slides in any way that you wish. Okay, there. So into the chat is the URL for the main book web page, where you will find all of the chapters available as PDFs for free download, and links to the videos that have already been prepared and that are continuing to be prepared. That's the default URL for the book.